the name Grace come in Grace Cancer Foundation?
Of course, we believe in God's grace. So it is a universal truth, especially most of the lower and middle income countries. The biggest issue in cancer is because we all have received, right? Somebody has paid for it. The taxpayers, the country has invested in it. If somebody is not giving back, that's abnormal, I would say.
Good afternoon, everybody. This is Rajiv Lal welcoming you to another of EQUIPPP's knowledge series. Now, I think almost everybody who's watching this podcast would have seen Doc somewhere or the other. But still, as a very quick one, Doc's one of India's leading robotic oncology surgeons. He's the co-founder of Grace Cancer Foundation, and he's a supporter, member, director of so many other impact organizations, very active in HIC in Hyderabad and many other such organizations. So with that, Doc, since you've done so much, why don't we do a little bit of the backstory?
Sure.
And start with, how did you become this renowned oncology surgeon, starting from your Navodaya school days?
Thank you, Rajiv, for having me here, and it's such a pleasure to work with you. And I think it's very nostalgic for me when we look back into my story. As many know that I come from very humble beginnings, from a rural background. My parents were simple farmers, and I was a go-lucky kid in the village to helping the parents in the farm. But the purpose for my life unfolded even as the country invested in my education through Navodaya. Right, that's when I think the biggest turning point in my life is in the 6th class, when the Navodaya school was for the first time in the country. It started, and then that's how I entered into a good education. I think that was given to me by this nation, for which I'm ever grateful. So that's how the seed was sown with a good education from 6th to 12th, and then this cowboy, farmer's son, goes on to join medicine, which became a history in my village because nobody ever passed beyond 12th grade. So in that sense, I'm grateful to God for this privilege to serve the people through this profession. And once I finished my medicine, again, I never dreamt that I would do a post-graduation, but the provision was divine, and I was really fortunate to get my master's in general surgery through All India quota, and then went on to do Super Speciality in surgical oncology again in Gujarat through the All India quota, where for a country of 100, that time about 100 crores, we had 10 seats in oncosurgery, and this farmer's son goes on to get that seat and becomes an oncosurgeon. I think it's all the purpose, and the universe conspires, people say, right, for all things to work together for good. So that's how it happened in my life, and I'm really pleased to be what I'm doing.
So that's being very modest. But I think for the people who were listening, you would have perhaps have gotten to the fact that there were 10 seats and he got one of those. And that has been actually Doc's story through his life.
Yes.
Right? But I think the other thing you would have got through his, what he said just now, is his sense of gratitude and not entitlement, which is a very, very big thing. So, which is what brings me to my next question, Doc. How from all of this busy, your life is very busy. A robotic surgeon has a very busy life, and it can be even busier. It's up to you to decide how busy
Correct.
It will be, right?
Correct.
From here, how did the service mentality come? How did you decide that you have to give back?
I think giving back is actually blessing for us. See, somebody is given opportunity to give something to them. It's our privilege, I consider, because we all have received. See, I have received the education from Navodaya school, right? Somebody has paid for it. The taxpayers, the country has invested on me, right? So in that sense, it's natural for us to give back. It is not abnormal. If somebody is not giving back, that's abnormal, I would say, right? So giving back should be it is your persona, it should be. That's how. So for me, it's a blessing to give back, and I've been taught these things about national integrity and the national integration, and in terms of the community building. All this has been inculcated to the right education at the right time. So I think, over a period of time, this has strongly, influenced the way I think and want to give back. See, I think to be able to serve someone is a wonderful opportunity and a privilege, which not many people have in that sense, right? So I think that's how the whole concept was ingrained in my mind through the right education and what the country has done in my life. So we need to give back.
Again, there is a story here which I will go to, and I think the best way I can go to that story is by saying, how did the name Grace come in Grace Cancer Foundation?
See, if I had to be a little bit philosophical, grace is actually an unmerited favor, right? So for someone, even if they don't deserve, if you give something to them, if they don't ask, they don't seek, right? But for me, when we started the Grace Cancer Foundation, it's an acronym. Of course, we believe in God's grace, right? But the acronym is Global Research and Cancer Education. That's what GRACE stands for, right? So how can we have a global impact in research, in cancer awareness, cancer education, and in cancer care holistically? So I think that with that in mind, the name GRACE was put. So the full form of GRACE is Global Research and Cancer Education.
Doc, again, just building on that acronym, right? So how did that leap come? There is GRACE, right, which is, as you mentioned, about research. It's about cancer education. And then from there, you go to early detection.
Correct.
Right? So the impact of early detection will come to in just a bit.
Right.
How did you go from research and cancer education to early detection?
See, I think, Rajiv, one thing in this part of the world, most of the lower and middle income countries, the biggest issue in cancer is lack of awareness and lack of access for early detection. Because even in my practice today, 70 to 80% of the patients that I see are in late stages, wherein the outcomes are not good. So it is a universal truth that early detection saves lives. The outcomes of cancer are always much, much better. Cancer is curable if detected early. So given that notion, why can't we take this across to the communities and sensitize them, create awareness, and because if you look at the screening rates in this part of the world, it is not even 2%. So even in urban, it is not even more than 5%. So given that, I think there is an unmet need here. That's what pushed us to focus on early detection other than just awareness and research, what we initially started off with.
Again, docs being modest, because the easier thing is actually education, because what you do is you create some pamphlets, you create some videos, and you say that. Detection actually means you're staying in the medical space.
Right.
Because detection can't be done by anyone. Detection has to be done by a medical oncologist, right?
Correct.
And then that medical oncologist needs the equipment.
Yeah.
And then that equipment needs to be available on site.
Correct.
Right? Because you don't want the people to come to you. You are going to the people, right?
Correct.
It's a fairly complex undertaking if you take it like that, right?
Correct.
So why don't you tell us the story of the first bus that Grace Cancer got and how it actually went from there?
Well, Rajiv, if I had to really tell you the very kind of the painful story of how it all began, right? It so happened that on a particular day when I was doing surgeries in a hospital in Kakinada for my monthly visit, and early morning when I was traveling back from Gautami Express, I got a news that my mother became unresponsive, and she went to help somebody, and somebody picked her up on a two-wheeler. She fell, and the news that she is no more. And when I went back from Hyderabad to my place, more than 1,200, I think close to 2,000 people came to pay their respects to her in a small village. So she was a big influence in my life in that sense, because she touched so many lives, and they came to so I think that's a kind of legacy that she lived. So that really kind of inspired me that if you have to live a life, you should actually impact at scale people's lives. That was something that I was really kind of taken a motivation from her life. And even on that pain, when I was really questioning why this happened to me and all that, the State Bank of India, first time they then some of their CSR team reached out to us. You are doing something good in research and education. Can we do something from our end? And that's when, it's so providential in that sense. Pain always gives you something really, long lasting, something, some purpose is found in pain. And that's when the mobile cancer screening campaign, came. The first bus was donated by State Bank of India. I said, maybe I would continue mother's legacy in terms of, contributing financially for the bus and driving it so that, the legacy continues to keep on serving people on wheels. So that's how the first bus came, and the rest is history. Today we have about 6 buses to be able to screen, more than 1 million lives so far, and to kind of, take this to the doorstep of a common man who do not have access to this early detection.
So, just building again on that, right? The whole story of scale. If I'm not wrong, Grace has got 5 Guinness World Records for the scale, the work at the work that it has done. Right, for the largest oral cancer camp, the largest SPV vaccination camp, etc., etc.
Right.
So now this is, again, it's so easy to say scale, right? Now, since I incubate companies, we all know that scale is one of the most difficult things to do, right? That's where
Correct.
most fail.
Right.
So how were you able to actually do this? Because now you've reached a stage where every month you do as many as 2,000 screenings. So, I mean, that's a lot of screenings. That's like what most hospitals don't do that many screenings, right?
Sure.
So how did first the notion of scale come, and how did you build the organization to be able to do that scale?
Rajiv, I think for me, scale is not just a record for the sake of recognition. Every life that we touch is very important. But at some point of time, scale is important in terms of impact. See, the more you reach, because the problem is so big, otherwise it becomes just a symbolic work that I'm just doing just to kind of, show that, okay, this is just an example. This has to reach, this has to be democratized. Right, so that's when I think the very idea of taking this, mobile buses across geographies, multiple states. We have done work in Orissa, we have done some work in West Bengal during the COVID times, especially in that, cyclone times.
Correct.
Yeah. And then we have been able to do a lot of work in other states like Karnataka, Maharashtra, and Andhra Pradesh, Telangana, of course, is our core, areas of work. So I think, once you have a right purpose, scaling is natural for us to, have a higher impact. So that's how I think, we've been able to have a good team of, doctors and paramedical staff and well-wishers who all actually, it's always teamwork at the end of the day. You need a lot of volunteers. I think, with so much of operations today, the full-time employees at GCF is not even 22 today. So that means we run very lean in terms of the cost and the how much we spend on the fixed salaries for these people. But a lot of volunteering is coming in, a lot of contract employees we're taking in different sites where the buses go, so that we minimize the operational cost and reach more people. So in that sense, I think we've been fortunate to serve more people, touching close to 14 million lives so far in the last 12 years. And I think screening about 1 million people. I mean, this year, as you know, the target for screening by December end is 100,000 people. And we are at 75 plus thousands now. So I think, to be having that purpose, number is not for the sake of number or for identity or kind of some kind of a accolade, but to really touch lives. Every life, at one life at a time, and keep touching as many as you can. I think that's where I find great joy.
Actually, let's make this slightly more real, right? Because you're talking at a philosophy level, but let's bring it. Assuming that there is somebody who has been detected early, so which means stage 1,
right?
And somebody who is detected late, which
Right.
is say late stage 3 or stage 4, which is where 60-70% of the people are detected even today.
Correct.
What is the difference in mortality? What is the difference in cost?
See, I think, you've asked the right question in terms of the how much difference does it make to really detect early, right? See, stage 1, most of the cancers, I would say, are fully curable. Fully curable. I'm not talking about prolonging the life or kind of adding years to their life. We believe in adding life to their years, right?
Correct.
So, in that sense, outcomes gradually, drastically come down when the stage increases. So stage 4, we actually don't talk about cure. We are looking at only prolonging the life.
Correct.
Right? It's a palliative care. Usually stage 4 in general is not curable. In some cancers like testicular cancer or some other sites where there is limited metastasis where you can look at cure even in stage 4. But by and large, stage 4 is actually incurable. So given that from 100% cure to something which is incurable, I think there is a huge value there. The financial strain is too much. If it is stage 1, most of the times you require one modality of treatment like surgery or radiation or just chemotherapy. Whereas it's advanced stage, you need multimodality treatment.
Correct.
So that increases the cost at a multiplying level. So I think that's where I think the biggest toxicity today in cancer care is the financial toxicity.
Correct.
Right? It's not the side effects of chemotherapy. Because here, along with the patient, the whole family suffers.
Correct.
So in that sense, there is a huge, I can't quantify exactly how much, but it is multifold and the outcomes are poor. So you spend money, but your results are not good. Here you are looking at a cure. I think that's where, that we need to scale to save lives.
So I'll give you a sense, I also do some work with the bone marrow transplant guys, right? BMT Foundation. So between stage 1 and metastasis, the difference is between 30,000 rupees per year to 60 to 70 lakhs for a single cure. That is the
tremendous, huge
scale of the difference that is there. So it's 30,000 most people can kind of with some difficulty manage. 60 to 70 lakhs most people are going into debt.
Yes.
So that's the difference.
Yes, huge.
Right. So the difference is phenomenal.
Yep.
So moving on from there, Doc, I think one of the things that very few people talk about is the tremendous innovation that you have made that makes this possible, which is the cost per screening.
Right.
Right.
Yeah.
So can you talk about what is the cost per screening now and how you manage to keep it at this level?
See, scale is possible when the cost is as low as possible. Now it all depends on again what all tests you include in the screening, but at least to look at 4 most common cancers. For example, oral cancer, lung cancer, breast cancer, cervical cancer. These are the topmost 4 cancers. Right? You don't screen for every cancer. There are more than 100 types of cancers which you don't have to really screen for them. Screening is for public health issue which is very common that we do. Now, if the cost per screening is less as possible, you can reach to more people. That is the very simple logic with which we work. And initially when we started, the cost was more than 1,200 to 1,500 per patient. Now gradually we're able to bring that down to around 400 rupees, which includes a mammography, pap smear, X-ray, oral examination, screening for diabetes, hypertension, and also do any biopsy for those there is a suspicious lesion. So in that sense, we've been able to really bring down because of the optimal resourcing. I already mentioned to you, right? Our overheads are very less, and that's how we're able to. A lot of volunteering is also coming in, but again, you can't depend entirely on volunteering because it is episodic. So consistently performing, having the quality, is very important. But one good thing, even as we could bring down the cost, what we have realized is bringing technology and innovation. I think that's where tele-oncology, we have now digitized the entire process now. The entire screening process is now online or digital. People can have a dashboard to see in which village, what screening is happening, what are the real-time outcomes. All that can be now, tracked from anywhere in the world. I think that's where we have been able to really make this much more, not only cost-effective, but scalable also. All right?
In fact, I think what you've done is you married 3 things to make this happen. One is that you've created a good mix between the volunteer and the permanent staff.
Correct.
So that's great.
Yes.
The second thing that you've done is that you've gone to places where people don't go.
Correct.
Right. So that's literally you're reaching the unserved.
Yes.
Not just people don't go in terms of access to cancer. It's access to medical facilities, which is the problem, right?
Correct.
And the third thing, I think, which lot of impact organizations don't give enough emphasis to, is that you have created protocols.
Yes.
So the entire process is protocol driven, which is embedded in a software system.
Correct.
Which is what actually enables people to walk in, because otherwise you would have a huge cost of training. You can have a lot of volunteers.
Correct.
But then every time a volunteer goes, you have to train the volunteer.
Correct.
Whereas since it's embedded in a software system,
Correct.
the transferability is very simple, right?
Yes.
So I think first you need to talk to us a little bit about the protocolization, the embedding it in software, and the fact that you are a doc and therefore you understand the value of this.
Correct.
So how did, and so this whole process?
Sure. I think, see, what we call as the process is called as the GCF way. Right? It's an 8-step, well-defined, systematic, approach to do a comprehensive screening for NCDs, including cancer. So, right from the registration to, their vitals, to their consultation, to their mobile bus screening test, to again back to consultation, their pharmacy, follow-up. This is the standardized 8-step process which is repeatable, replicable and scalable. So I think that is one thing that, time and again we have done thousands of camps, so we've learned our lessons through that, to standardize the entire process. So now anywhere, any village, people just follow these 8 steps. Right? So anybody, even for the first time somebody comes for a screening, camp, they'll be able to follow the protocol very easily. And it is easy to teach and train also because we have simplified the whole process. And now on top of this, we have added the digital protocols. We have added the new software developed, which is kind of very innovative. And as I mentioned before, kind of gives you a real-time display of what's happening, resource optimization, waiting times for people. All that can be, calculated real-time. So in that sense, yeah, we've been able to make great progress through this kind of an innovation with, protocol being standardized.
And just in case people were thinking that, the education part has been left behind, that is not so.
Correct.
That's, I think, one of the big things is happening on this Saturday, on the 12th. Yes. Which is the Grace Cancer Run, which is Sunday. Now Sunday, which is now an annual event and something that's part of the calendar, not just in Hyderabad, but in a few cities in India and some cities around the world as well.
Correct.
So how did GCF conceptualize the run?
Right.
And what are your expectations from the run?
I think, Rajiv, one of the flagship events of Grace Cancer Foundation is the Grace Cancer Run, what we call as the Global Grace Cancer Run. What we started as a small, kind of a cancer awareness drive or a run during the month of October, which is a breast cancer awareness month. In 2018, we started the first edition with about 3,000 to 4,000 people. And then that is now, last year, we have, totally about 150,000 across 120 plus countries. And of course, we are not counting the education institutions, the other, NGOs and other people who are part of it directly or indirectly. But this year is the 8th edition of the Grace Cancer Run, and I'm really excited to say that we've already clocked more than 32,000 registrations in Hyderabad alone. And this year it's going to be held in more than 130 countries, both virtual and in person. In US alone, in 20 locations in person run. And more than 5,000 sign-ups in these 20 cities in US and of course globally. All the continents. This is happening in the month of October, not on the same date, of course, for logistics and various other reasons. But I think, we are using this opportunity to actually, bring that change in the lifestyle. Today, we know that lifestyle is a big issue. That sedentary lifestyle is set in. COVID has actually added more fuel to that lifestyle. And people just have the click of a button, you don't even get up even to your kitchen, right? You get everything right at your doorstep. I think that's where, most of the, NCDs are root causes of our lifestyle. So lack of physical activity is one of the preventable or modifiable risk factor for these non-communicable diseases. So that's where I think we wanted to bring that change. The change may take decades of time, in terms of the impact to measure. But in fact, this year we're also doing a research study on the impact of GCR, the Grace Cancer Run, in the city of Hyderabad with a huge survey being done with our research team, both from India and abroad. I think that's where we are able to measure that. But I think more importantly, this is going to be the world's largest cancer awareness drive with such a huge, this has actually crossed the Hyderabad marathon, which is about close to 28,000. I think it shows that people realize the importance of this cause. And this year's theme is very simple: run for grace, screen for life. I think, it's not about doing an event and then kind of come back a year later to do another event. It's not an event. We're not an event management organization, right? We are a purpose-driven organization. So this run not only is educating people, each person running is actually supporting one person to get screened for cancer. I think that's where, we are actually doing a fundraise to run at least 3 buses will run the whole year through this effort. So I think, I know it could be, you are a management consultant and you can, but this is naturally, fitting into us, and we're able to reach people and raise funds also to screen.
Yeah, it's also brilliant because it gives an individual a way to contribute.
Absolutely.
Because
Community participation.
Right. So I think that's again something which is very, very well built into the Grace Run itself. There's another aspect to the Grace Run that I think is also worth talking about. It is that slowly corporates are, becoming associated with the run.
Correct.
And so that's becoming a way of education, perhaps on a longer time frame
Correct.
than just an event. So I think that's again something that's
Correct.
very, very
No,
phenomenal.
I think, let me tell you, Rajiv, here is that, run is the culmination of the effort, because
Correct.
at least 4 to 5 months before, every weekend we have a webinar, we go to corporates, give them a talk on this and engage them. It's like kind of at the end of the day, the whole sequence culminates into the run. And then again you start the process, because this whole effort is more than 6 to 8 months actually on a year-to-year basis to do at this scale. Right? And one more thing that I want to mention is more than 80% of sign-ups this year is from corporates. So I think that's a good development, because they will be the change agents. They will be able to percolate this message across. And let me tell you, this year we're also getting from the social welfare students from rural Telangana, about 5 to 7,000 of them would be participating in this run, so that they take this message across to their parents, their areas, in their villages, and they can become the ambassadors of change. I think this is similar to what EQUIPPP is doing in terms of building the community, serving, and making it sustainable and then scalable. I think that's where I like what EQUIPPP does, and has been doing for years together these days.
So before we go to EQUIPPP, and that was a nice segue, but I'll just come back to the work that you did with the Navodaya schools, right? Because the Navodaya schools were tremendous ways by which the Grace Run happened, and by which the education happened, and there are phenomenal stories there.
Yes, I think more than almost close to 500 schools across the country participated. More than 4 lakh students and teachers were part of this drive. About 100,000 police people from Andhra Pradesh were part of this drive. So in that way, I think to be able to make these right at their young age, even in their school days, see, tobacco prevention, if you can prevent somebody from tobacco addiction, you are actually preventing about 40 to 45% of the cancers. Straight away, one cause, right? So similarly, HPV vaccination. So this awareness, basic things which people don't, even if they are aware, they don't implement or practice. I think that's what we are giving them as a takeaways. Even during this run, we have kept 5 takeaways for everyone, repeatedly emphasizing on that, because it's all about the cause and the purpose. Right? We need to really bring that tangible, something that they sustains in their life. It is not about just coming, dancing and having fun and going, but it's not the finish line that is important. It is important is to see the finish line is actually every life that we do screening.
Correct.
We go to their doorstep. That's where the finish line is. Right? So that's the loop gets closed.
And again, so I'll just build on that, on the finish line, right? Because I think one of the dreams that now Grace is pursuing is how it can impact people beyond the Grace Foundation, right? And how it can share its knowledge and its understanding with similar organizations around the world. And one of the things that you've been talking about is working in the local language, about creating your own algorithms which can be customized, and and where you take your technology to the next level, right?
Yeah.
So can you talk a little bit about that?
No, certainly. I think we did discuss about this quite a lot, in our brainstorming sessions, on how AI can help us to reach the people in their own language, right? Give them a follow-up advice, right, in their own local language, so that we don't miss anybody for follow-up, right? I think one of the important things through this technology adoption is that the reach is more, right, and in their native language, I think the scalability is straight away there, right? So I think that's where we are progressing, and a lot of AI models we are already working. Even for that matter, reading of mammography and X-rays or pap smears, right, at the point of care, so that there is no turnaround time gap. Because for a routine pap smear, the turnaround time is 2 weeks, And by then the patient is lost to follow up. Many times they're not interested even to look at the report, even if something is positive. So I think if you can able to give the reports in the real time manner the same day, I think that's where you are able to close the loop and give a meaningful service to them, not just doing an exercise of doing some tests, but the closure is made, that too, as rightly said, in their own understandable language. Right? If I give an English case sheet for them, it doesn't matter to them at all. They don't understand. It's just a piece of paper for them. And now to be able to something on their own phone, because these days almost everybody is using a smartphone or some, which in terms of technology, the adoption of mobile is very huge, right?
Correct.
So I think they feel empowered, when you communicate with them in their local language. I think that's where the transformation is happening, and I'm more excited on that as well.
And so now let's bring the notion of, one of the things we always need is finance.
Correct.
And, the Grace Run is one way. There are people from Tana who support us, and we are very grateful to the Global Grace Foundation for their support.
Correct.
We are also very grateful to the corporates who have helped us in our journey.
Yes.
To the volunteers.
Correct.
But as we scale, one of the things we are looking to is more institutionalized funding, where people recognize the work that we do, they value it, and then they say, okay, this is something we'd like to be associated with it, right? And that's where I think the social stock exchange starts becoming very meaningful, because it's a way where automatically the value and the transparency and the scale
Correct.
starts becoming visible to a whole community of people.
Correct.
Who would want to support such things in building the country out, going back to your first theme of giving back and national integration and so on, right?
Correct.
So, are you excited with what is happening at the Social Stock Exchange?
No, absolutely. For the first time when this concept was launched and I was, told by Lakshminarayan Garu and the EQUIPPP team, I was super excited, because the first time I heard a term called social return of, investment, right? ROI, right? So how you can measure your impact, for the community work. I think that's where, I was super excited, and definitely I think, institutionalizing and working with, in such platforms, I think helps us to scale much beyond, because what we are today doing is just a drop in the ocean, fully knowing that every drop counts.
Correct.
Right? But at the same time, the problem is too big. We cannot do alone. We need partnerships, collaborations with, governments, NGOs, various, all the community involvement. I think it is a multi-stakeholder engagement. For this to scale up, I think, something like Social Stock Exchange is going to be a game changer, so that, we are able to not just institutionalize, but, anybody can associate and can actually see the outcome.
Correct.
Real time, measurable, with all integrity and transparency. I think that is the system that has been brought in with this, the concept. I think I'm super excited.
And I think that's where we are very grateful to organizations like EQUIPPP, because I'm sure bringing this concept to impact organizations is not easy, because every impact organization measures its impact in a different way, unlike a corporate organization where at the end of the day you look at either valuation or profitability. But every impact organization has its own way of measuring whether it is creating value or not. And then to find somebody like EQUIPPP, which is actually willing to walk this path and bring people onto one platform, which is the Social Stock Exchange, right? And then bring that transparency, which is available and understandable by the general public.
Correct.
Right?
So in a nutshell, EQUIPPP is actually equipping.
Correct. EQUIPPP is equipping all the three people, like you said, the multi-stakeholders, right? It is equipping the impact organizations.
Correct.
It is equipping the funding organizations.
Correct.
And it is equipping, so the quote unquote, the retail investor.
Right.
Because that's the one thing that impact organizations have always lacked. I know we do some part of it through the Grace Cancer Run, where people can come in and contribute, but as a percentage of a total income, it's very small.
Correct.
Right. So what we hope is that with the Social Stock Exchange, the contribution of the retail investor, quote unquote, becomes a significant part in the way we empower, other people to carry on. Just as we I will close by giving everybody on this podcast a sense of what Grace Cancer Foundation has actually created. So let me start by the first number. Close to 1,100 people have been detected with early cancer so far. Now, as I mentioned earlier, the difference is between, in thousands to tens of lakhs.
Correct.
So just that, if you multiply by 1100, is would be enough. But in addition to that, what they have done is that there would be anything between, if and I'm extrapolating here, but anything between 25 to 30,000 people who would have been detected with either with some NCD or the other.
Right.
So again, if you look at the cost of NCD in the long term,
Correct.
right? Whether it is to do with blindness, whether it is to do with heart failure or whatever, that cost in the long term is brilliant. So if you're is not brilliant, it is actually huge. So if you catch it and you give them a way out, then again, not only are you making their life better, you are actually making them more productive, right? So that's another impact that Grace has had over this period. In addition to this, what Grace has done is that it has gone to places where there are no PHCs.
Correct.
I'm not even talking about going to places where cancer detection does not happen. It is going to places where there are no PHCs. So for the entire village, sometimes it is their only contact
Correct.
with a medical staff for the whole year.
Correct.
Right? And
You always say, wherever there is a road, our bus goes
our
there.
bus goes there, right?
Yeah.
Right? So again, and then just what Grace did during COVID, right? I think what they did was so phenomenal that it's actually a Harvard case study today.
Yeah.
They set up a hospital for COVID patients in roughly 6 weeks from the time they thought about
6
it.
days.
No, I'm saying from the time you thought about it, you got the funding, got the ventilator.
6 days.
6 days.
From
So-
concept to implementation.
Implementation.
Because time was of essence.
Correct. So
For wave
6
2, so many lives were being
Correct.
lost the time.
And also there again, right? You started with the concept of holding, and then took it to ICU,
Right.
right?
Correct.
So and then once it was over, instead of hanging on to it and pumping money and all of that, you were smart enough to say, okay, now the crisis is over, let us dismantle it,
Correct.
so that our focus remains what it should be, right?
Correct. Correct.
So therefore, that again is brilliant. So that's what happened during COVID. If you want to look at the Guinness records that Grace has done, don't look at it because of what Doc said. It's not scale. It's scale for a purpose. So there again, introducing HPV vaccines in schools,
Yes.
introducing the notion of oral care
Yeah.
in villages. In fact, everywhere where a bus goes, there is actually education around oral care, right?
Correct.
So you can look at, I don't know how many thousands of villages we've covered. That's the number of places where, oral care education has happened. And I can go on and on, but I'll just close simply by saying this, that very often we sit back and we say, what can we do? Dr. Chinnababu Sunkavalli is an example of what we can do. So thank you so much, Doc, for your
Thank you.
efforts and for your time.
Thank you, Rajiv. Thank you so much. Thank you, EQUIPPP.